We're just giving folks a minute or two to log in. Again, we're just giving folks a minute or so to log in. If you have any initial questions, please put them in the Q&A box and we will address them at the end of the session. We're still seeing some folks come in, so we'll give them a minute or so to get settled. Again, any initial questions can go in the Q&A box for our panelists to address at the end of the session today. Thank you all for joining us today. I will now turn it over to ASH Executive Director, Laurent Hubert.
Thank you very much, Megan. So I want to welcome and thank you everyone for joining us today for this webinar hosted by ASH and Corporate Accountability to mark the launch of the 2025 U.S. Tobacco Industry Interference Index launch. And we've had the privilege at ASH to be able to attend and participate in almost all of the negotiations for the Global Tobacco Treaty, the Framework Convention on Tobacco Control. And every time governments get together to negotiate this treaty, country after country, they state that the main obstacle to achieving and implementing the life-saving measures of the tobacco treaty is the tobacco industry being the main obstacle, something we see in almost every country around the world. So today we have three panelists who will join us today and will introduce us to the U.S. Tobacco Industry Interference Index, provide example of how the tobacco industry interferes in policymaking around the world, and suggestions on how to counter this interference. If you have any questions, please you can use the Q&A function at the bottom of the screen, and you can type your questions and address them to a specific panelist if you wish to do so. So I will introduce the first panelist, who's Nichelle Lkhagvadorj, who manages and who's the manager of engagement and special programs at ASH, and who's been running the U.S. Global Tobacco Industry Interference Index process now for a number of years. And she will provide an overview of the findings of the 2025 U.S. Tobacco Industry Interference Index. So Nichelle, the floor is yours.
Thank you, Laurent. Oh, great. Thanks, Megan. Just needed to share my slides. All right. Thank you all again for joining us today for this important webinar. Today, I will provide a brief overview of the 2025 U.S. Tobacco Industry Interference Index. I'll talk a little bit about how the U.S. has performed in comparison to previous years, as well as other countries. I'll also touch on why this index is important. I'll talk about practical next steps in terms of recommendations to counter tobacco industry interference and provide some examples of what has happened here in the US. So first, I just want to back up and start with what this index represents and where it all began. This report is part of a global initiative coordinated by the Global Center for Good Governance and Tobacco Control and Stopping Tobacco Organizations and Products. It's based on Article 5.3, as Laurent mentions, of the WHO Framework Convention on Tobacco Control, which states, as you can see on the slide, that there is a fundamental and irreconcilable conflict between the tobacco industry's interest and public health policy interest. And basically what this means is that governments have an obligation to protect their public health policies from the influence of the tobacco industry. And tobacco companies should not be able to participate in shaping health laws or policies. It also says that governments need to limit interactions with the tobacco industry as much as possible, and that the government should ensure transparency when those interactions do happen. So these reports, both the global and the US, measure how effectively governments are doing to prevent tobacco industry influence. And each participating country, I believe there were 100 participants in this global survey this year, but each participating country, like the US, produces its own national report using the same standardized methodology. So why are reports like this so important? Well, first of all, tobacco use still remains the #1 cause of preventable death in the US. It still causes nearly 500,000 tobacco-related deaths annually. Not only that, but nearly $250 million in health-related costs also annually. The tobacco industry's political influence blocks life-saving regulations, and the tobacco industry's interference remains the greatest barrier to public health progress, as Laurent mentioned earlier. So these indexes help to expose this interference so that advocates and policymakers can act. So now I'm just going to get into how this index was developed. The report covers data between April 2023 and July of 2025. These reports are produced every 2 years, so the next report will come out in 2027. And scoring for this is based on a 20-question survey, which ranks indicators across 7 categories. So those categories are laid out here on the slide. We have industry participation and policy development. This looks at whether the tobacco industry is allowed to take part in making or shaping health policies. Ideally, of course, they should not be allowed. Industry corporate social responsibility activities. This measures how much the industry uses charity or community projects in partnership with the government to improve its image and gain influence with policymakers. Benefits to the industry. This tracks whether the government gives the tobacco industry any special treatment like tax breaks, incentives, or relaxed regulations. We have unnecessary interaction. This checks how often government officials meet or communicate with the tobacco industry beyond what's strictly necessary for regulation. In addition to that, there's transparency. This looks at whether any meetings or interactions with the industry are made public and transparent. We have conflicts of interest. This measures whether government officials have ties to the tobacco industry, like investments, jobs, or accepting gifts and sponsorships. And finally, preventative measures. This looks at what the government is doing to actively protect its policies from industry interference, like having clear rules or codes of conduct in place. So this evidence is gathered from all publicly available sources, media, pages, government records, things of that nature. And indicators are scored using a standardized tool where 0 indicates no interference and 5 indicates the highest level of interference. I do want to briefly mention that there were 2 new questions introduced for the 2025 index, but they did not factor into our score. The first one was on liability, and this one asks whether governments have adopted or enforced mandatory penalties for tobacco industry in case it provided false or misleading information. And the next one was on the Article 5.3 Knowledge Hub resource. And it basically says that government should create laws and policies that give the public easy access to information about tobacco industry activities, such as by publishing it in a public database. So now I'll get into this year's score. This year, the US scored 89 out of 100 on the Global Index survey. This was a big increase from 80, which was reported in our 2023 report. This is the worst score that the US has ever had. Since we began collecting this data in 2019, this is by far the worst score that we've seen. In addition to that, this will be the third time that the US ranks within the top 10 worst actors in terms of tobacco industry interference. The score basically reflects a deepened level of tobacco industry influence, and it has been driven by several factors, including policy withdrawals, political appointments, lobbying and campaign spending, which I'll go into shortly. I do want to point out, though, that there are some limitations and variances in terms of how the US handles our reporting. The first one is that tobacco control policies are made at several levels of government here in the US. So we have federal, state, and local, and that gives the industry multiple ways to influence decision making. So our report captures a broad sample of that interference across different levels of government, but it's not an exhaustive count of every instance. In addition to that, the US score was adjusted in the global index because the US has signed but not ratified the WHO FCTC. So its final score is calculated differently from countries that are actually parties to the treaty. So where did the US do the worst? Well, across nearly every category, we found a breakdown in safeguards against tobacco industry influence. For one, there's no official code of conduct for public officials. We don't have any requirements of disclosure of meetings with industry. There's no conflict of interest prohibitions, and there's no clear policies rejecting industry partnerships or donations. These gaps have created an environment where the tobacco industry can shape policy with little oversight. And that's reflected in several areas, including ongoing industry participation in policymaking, including state laws that have been written with industry input. We have corporate social responsibility programs that allow companies like Altria to appear as public health allies. And then overall, a lack of preventative measures. There's no federal standards to limit political donations or revolving door appointments, or any awareness programs to educate on Article 5.3. So together with these weaknesses, that explains why the US ranks 98th out of 100. And these scores aren't just theoretical, they reflect real recent events. So let's look at a few examples from this year's report that puts this interference in practice. So here on this timeline chart, you'll see some of the major events that have happened more recently over the last 24 months. You know, we start with the FDA's proposed ban on menthol cigarettes and flavored cigars, which was repeatedly delayed under heavy industry pressure. We also have political appointments such as Susie Wiles, a known tobacco industry lobbyist who was then appointed to White House Chief of Staff. We also have the FDA formally withdrawing the menthol and flavored cigar bans altogether, reversing years of public health progress. In addition to that, we have the shuttering of the CDC's Office on Smoking and Health. This was a federal, this office was the backbone of, you know, cessation programs and good science in tobacco control. And it was closed and its staff laid off. And these cuts have rippled down nationwide. So we have states reporting losing funding for quit lines and cessation programs, leaving more people without support. And then finally, I just point out that ASH's lobbyist tracker, which we updated and launched an update to earlier this year, we saw a 24% increase in registered tobacco industry lobbyists, which is a clear signal that the industry is expanding its influence at every level of government. So I'm not going to take too much more time because, we want you to go and read the report and really digest it. But I do want to touch on some of the recommendations that we have. First, we need to raise awareness of Article 5.3. Even though the US hasn't ratified the treaty, its basic principle is simple: keep the tobacco industry out of public health policy making. Second, we should tighten and standardize revolving door rules so people can't move straight from government jobs into lobbying for the tobacco industry. Third, we need to close the ethics loopholes that still allow conflicts of interest to slip through. Fourth, we must make sure that the approval processes are based on independent science and not studies funded by the industry. Next, and this one's very urgent. We need to restore public health offices like the CDC's Office on Smoking and Health. Their closure has left a major gap in prevention and oversight. Six, we need a clear code of conduct that tells public officials exactly how to interact or not interact with the tobacco industry. And then we need lawmakers to be educated on the industry and their tactics. Many simply just don't realize that it's happening or understand the consequences of interacting with these entities. And finally, we should require full disclosure of tobacco company donations so they can't hide they can't hide their political influence behind so-called philanthropy. So I think together these steps kind of give us a roadmap to rebuild the safeguards that protect US health from tobacco industry interference. So I will just close to say that, thank you again for joining us today. We really encourage you to go view the report. The link is there on the slide. My email is on the slide because as a practical next step, you can always send me information directly. I'm happy to schedule meetings or calls with individuals to talk about what they've witnessed in terms of industry interference, as well as also visit our tobacco lobbyist tracker. Again, that was updated earlier this year, but please visit that and provide us with any feedback that you have. And with that, I will end my presentation and hand it back off to Laurent.
Thank you, Nichelle. That was quite instructive, and it's sad to see the US going backwards instead of forwards when it comes to addressing tobacco industry interference. Our next speaker is going to be Alan Gallagher, who is a research fellow at the Tobacco Control Research Group, TCRG, at the University of Bath. And Dr. Gallagher will share insights into how the tobacco industry strategies in the US align or diverge from global playbooks. Alan, the floor is yours.
Perfect. Thanks so much, Laurent. So I'll kick off. As Laurent said, Alan Gallagher, I'm a research fellow and co-director of the Tobacco Control Research Group. And today I'm going to kind of expand on what Nichelle was saying by talking a little bit more about some of the findings from the US index and some perspective on the extent to which these seem to align with industry global playbooks. So just first quick conflict of interest declaration. Be pleased to hear we do not accept any funding from the tobacco industry or other commercial organisations whose interests are not aligned with public health. So what I'm going to cover today, hopefully without being too repetitive of the previous presentation, is I want to pull out some examples from the US index and contextualise these in the context of the 2023 Global Index, as well as the upcoming 2025 UK Index, which I'm the lead author of. So that will be released later in the next month alongside the Global Index. So please look forward to that, but I'm going to give you a bit of a sneak peek today. So I then want to consider how these findings really relate to existing research on industry policy influence strategies globally, and then finish by giving some of my own perspectives on the extent to which the findings from the US align with kind of global evidence around industry strategies to influence policy. So, firstly, I think an important contextual factor here is that the US is particularly vulnerable to tobacco industry interference. Its status as a non-party of the FCTC, as we've heard already, combined with the industry's strong market presence, extensive lobbying expenditure, are all factors. But we also know in terms of tobacco production in the US has reduced substantially in recent years. It is still a factor of the economy too, and we know from existing academic research that actually the existence of tobacco farming and production in a country does actually correlate with its score in the Global Interference Index as well, being the more farming and tobacco production you have in a country, the higher the levels of industry interference are likely to be. So
Alan,
if
I'm
someone,
sorry
yep,
to
please go
interrupt.
ahead.
Should we be seeing
Yep.
your slides?
Oh, are you not seeing my
No, we're
slides?
not seeing them.
Oh, apologies. 1 second. Let me do something about that. Hopefully. Hopefully you can now see my slides.
We see them in, but not in presentation mode.
1 second. Hopefully it's just loading. Okay. Are we good now?
We're good. Yeah.
Perfect. Okay. Let me just yep, conflict of interest coming up. Covered all of that. Yep. So as I was just saying, just some example there in terms of tobacco production in the US. So yes, as I said, let's look at some examples then from the report. I've got a quote here just to kind of demonstrate one example of engagement with the industry and the policy process in the US. And this is something that we see repeatedly in the global index as well. Numerous examples of the industry interfering in policy, which led to delays or policies being overturned completely. We've also seen this to some extent in the UK too. We currently have legislation passing through the Parliament that would ban tobacco sales to those born after 2009. And we've seen MPs and members of the House of Lords being lobbied by the industry to try and weaken this legislation, namely trying to get heated tobacco products exempt and to have a ban replaced with an increase in the age of sale, so a less effective measure. One example of this is you'll see the screenshot at the bottom there is a member of the House of Lords recently saying that he was discussing the bill with someone senior at British American Tobacco. Bear in mind, this bill is actually currently passing through the House of Lords right now, and so industry-friendly amendments are still being proposed. So really, this is an example of kind of industry interference kind of currently happening and concerns around it. And Nichelle already touched on kind of industry CSR. There are numerous examples in there of corporate social responsibility campaigns, such as Altria's long-term support for the Keep America Beautiful letter program. This is a really good example of industry greenwashing, so corporate social responsibility measures, but focusing specifically on the industry trying to present itself as environmentally responsible. And again, we see a lot of this globally, 15 different examples specifically of industry-funded letter campaigns in the Global Index in 2023. And again, we can draw examples from this in a UK context too, with members of the House of Lords serving as directors of a Japan Tobacco International funded littering campaign. We also have examples, of course, of broader industry corporate social responsibility activities such as funding museums, sport and music events as well. And I suppose this really isn't an industry tactic per se, but it does kind of align with the criteria for the index, and I think is useful context here, which is really how transparent are activities of the industry in the US compared to elsewhere. Here, I would say, the US is one of the few countries that does have a lobby register capturing tobacco, but as noted in the report and as noted by Nichelle, there's a lot to be done in terms of transparency in the policy making process and protecting the industry from that. have just a quick quote here, just to kind of demonstrate the extent to which this is an issue in the US. You see here it's also an issue with the UK. Essentially, the UK Department for Health and Social Care do have measures in place for adherence with Article 5.3. One of the concerns from the report is that compliance with this is lacking in certain departments, whereas when comparing that to the US, they simply lack those comprehensive mechanisms in the first place. Coming on then to instances really where the industry's benefited from preferential treatment. Again, we see policy cancellations and policy proposals, and Nichelle touched on that in the context of FDA regulation in the US. There's also a little bit in terms of the financial incentives for the industry. And again, in the US context, the continued subsidizing of tobacco farming, for instance, stands out. But if we look at kind of wider global examples, we see a similar kind of treatment, preferential treatment towards the industry within kind of the global economy. In the UK, for instance, the Trans-Pacific Partnership Agreement enables 0% duty on imports of various tobacco products for the different countries involved in the agreement. So from that, I would kind of say there's also a wider structural issue here with regard to kind of the existing global economy, really providing lots of incentives and benefits for the industry. And so here, just in terms of unnecessary interactions as well between the industry and policymakers, this is really just an example from the US report and also from the UK report to see that we're seeing, very similar efforts here in terms of the industry offering flights and accommodation in order to gain access to important stakeholders in policy discussions. Just to kind of move beyond the US example for a moment, I would say we, of course, see many other forms of unnecessary interactions between the industry and those with policy influence, such as political party conferences receiving industry sponsorship in the UK. But of course, it's kind of also a bipartisan issue in the US in terms of essentially the industry is able to kind of infiltrate and influence governments on either side of a political spectrum. And again, we see that not just in the US, but beyond. We also have kind of other forms of unnecessary interaction, diplomatic missions, essentially kind of supporting tobacco companies and even government officials giving tobacco companies awards. So yeah, just to touch also briefly in terms of kind of conflicts of interest there, we don't either in the US or in the UK have really good legislation to kind of currently stop those conflicts from happening in terms of political parties. Nichelle also touched a little bit in terms of revolving door, and we see from the US report that that's really an extensive issue there. But again, we have many examples of that globally as well. A good example from the UK comes from this year, actually, where Penny Mordaunt, who was a minister in various government departments, so the Treasury, Ministry of Defence at different points in her career, upon leaving government, she went on to work for British American Tobacco. And again, just not so much industry strategy here, but I just think really important to stress because ultimately in contexts where policymaking is not protected from industry interference, such interference really becomes more ingrained and harder to combat. And here we just, again, just using the UK as kind of a comparison here. The UK does have clear guidance on adherence to Article 5.3. Whereas currently we don't see that same level of clarity and guidance at the US level. So coming back then to talk more about kind of the industry tactics with some of that context covered, I noticed a few other kind of findings from the US report that I think align with what we're seeing the industry do at a global scale. So I want to speak a little bit about those. So firstly, there's a real reliance on front groups. This is a well-documented industry strategy of trying to present its positions from a more palatable and kind of seemingly, but not really, independent perspective. There's also the co-option of law enforcement, particularly in the context of measures to address illicit trade. So we have the industry providing training to law enforcement bodies in the US, as well as the Department for Homeland Security entering into a memorandum of understanding with Philip Morris. These are strategies that we see across the board globally. Even, Philip Morris in particular regularly boasts about training customs and law enforcement officers. In some cases, they arrange photo shoots from these sessions that they then include in their annual reports. And on memorandums of understanding, there's research looking at these, and it's found that there's been over 100 such agreements between governments and the industry since 1990, specific to illicit trade, but there's been no evidence that any of these agreements have actually reduced levels of illicit trade. And that's perhaps unsurprising if we consider that the agreements are not legally binding and generally they tend to lack transparency as well. We also have the FDA examples from the US report, really touching on the industry using its own evidence in relation to its own products in order to try and influence policy outcomes. This is again a key industry strategy. It's been utilized since the harms of tobacco products were first identified. But in a modern context, we are indeed seeing the industry manipulate science largely in the context of their newer product portfolios. A colleague of mine at the TCRG, Sophie Brasnell, has done a lot of work exploring the claims that PMI make in the context of ICOS specifically, and find, it's largely industry-funded science, which is questionable when compared to independent research, and that PMI is using kind of a number of claims relating to harm reduction to try and promote ICOS. And these claims actually differ between countries and actually in some cases appear to be contradictory to each other. And what this tells us is that the industry really is working to control the narrative around its products to best fit different current regulatory contexts. And I think in a large part the US context has been about trying to influence FDA understandings about the kind of next generation products. That also aligns with kind of the last example I want to give here, which is really that these efforts are part of a wider industry strategy to present itself as transformed and moving away from tobacco. I'm sure we've all heard this narrative before, but of course, in exploring that, there's really not a lot of credibility to the industry's claims of transformation, and that they're continuing to invest in combustibles and largely in using new products as a means to try and muddy the waters around existing tobacco regulation, as I've touched on already. I was involved in some work which looked at PMI's claims about reducing its shipments of traditional cigarettes, for example. And we found that not only did the company set very low targets for itself, very easy to achieve targets, it actually ended up failing to meet those targets anyway, because since making that pledge, it ended up increasing shipments of traditional combustible cigarettes. So if you kind of haven't kind of figured it out already, my perspective really is that the findings from the US report are largely consistent with evidence of the industry strategies globally. And this becomes clearer when we look at some kind of previous TCRG research, where we look to set out what the industry kind of global political activity looked like for reviewing existing global literature. And that resulted in what we call the policy dystopia model. This is really a way of identifying the key tactics that the industry used to try and achieve an overall goal of presenting tobacco control policy is likely to lead to a dystopian future. So to be wholly negative and bad for society. And so when we look at the strategies that they use to try and make these arguments, we'll see a lot of similarities with the different things we've just been discussing. So again, we already have multiple examples of direct industry lobbying efforts within the US report. Reputation management as well in the context of presenting itself as transformed, coalition management also in the context of extensive use of front groups, and also information management in the context of the industry funding its own research and trying to use that to influence policy outcomes. So really to kind of summarize here, I'd say that the kind of industry strategies identified in the US report really do mirror findings at the global level, and that's demonstrated by other index reports, but also by kind of broader academic research looking specifically at industry strategies. And while it's true that, the industry does tailor messaging to specific country contexts, its broader goal of influencing and undermining tobacco control policy is one that applies globally, with a very similar playbook of key tactics being identified. And as such, a kind of last comment from me would be that the global index and the report within them are really important for understanding then how governments can protect themselves against these threats. And as I've touched on throughout, the US is currently quite vulnerable to such efforts, which is why the recommendations from the report, which we've heard a lot about from Nichelle already, are so kind of crucial to improving health outcomes. Okay, I'll leave it there. Thank you.
Thank you for that, Alan. And you really stressed that important need, I guess, to monitor both what's going on at national level as well as the global trends. We're so lucky to have both that global work, the Global Tobacco Industry Interference Index, as well as all of this national work, which also can help not only the tobacco work we do, but also areas of work in global governance where commercial determinants of health have an impact on health and the environment and so on and so forth. Our next speaker is Ashka Naik, who's Chief Research and Policy Officer at Corporate Accountability. And she will address moving from documentation to accountability, as well as strategies for strengthening enforcement and government protections against interference. Something that we see, unfortunately, not only in tobacco control, but other fields. And she will give us that more global and broader perspective of industry interference. Ashka, the floor is yours, and perfect. It's in the presentation is on presentation mode.
Wonderful. Well, thank you, Laurent and the team for inviting Corporate Accountability to partner on this launch. This report is truly a mirror into what we are up against as a society, as the state is being increasingly captured by corporate power. So my presentation today will focus on moving from assessment of this power to holding it accountable, with some proven examples and strategies for strengthening enforcement and government protections with a sort of an intersectorial and some international perspectives that the US can learn from. Here is my own declaration of conflict of interest, in which I disclose I have none. Corporate accountability does not accept any contributions from corporations or governments. Just the outline of the content for this presentation, I will begin by just laying out how the landscape of corporate power is evolving quite rapidly, then move into discussing one specific example from the ultra-processed food industry that takes all its cues from, seems like, tobacco industry. Then the urgency to frame this type of interference as a real corporate liability and using the lens of corporate political activity to track this interference as liability, and then moving to some real accountability measures with some examples from the field. And so, the landscape we are dealing with, both of public health and how corporations behave, has evolved significantly from early 1900s, when the concept of public health was being formalized due to increasing urbanization, industrialization, and unhealthy environmental conditions becoming common in working class areas, diseases becoming rampant. Today, we are seeing that the extraterritoriality of corporate actions are immense. Majority of the transnational corporations, including tobacco companies, are headquartered in global north and have a majority of resources and labor inputs from global south. We are seeing a complex web of subsidiaries and investors. By 2022, the leading transnationals created nearly 370,000 subsidiaries globally. Additionally, only a handful of institutional investors are the biggest shareholders, further sort of centralizing this corporate power in the hands of very few. Co-optation of charity and philanthropy, we are certainly seeing philanthrocapitalists kind of pushing for a conceptual shift in our belief that profit-making and public welfare can be mutually aligned constructs. Diversification, we are seeing especially among those selling harmful products, often using business diversification to ensure market growth, revival of public image, management of risk, and so on. There are also just more transnational corporations. There used to be 7,000 or so in 1970. Today, there are more than 40,000. We are also seeing decrease in publicly held corporations. So number of, say, public companies listed in the US has fallen by nearly 50% over the past 2 decades. And this matters because as private entities, these companies now adhere to a different legal jurisprudence, less transparency, less public accountability, and so on. And also on the ground, where social movements and civil society works, we are seeing that we are becoming more multipolar. Multi-stakeholderism is replacing multilateralism. Social movements are becoming more professionalized, but also risk of SLAPP suits. This is strategic litigation against public participation is increasing. Certainly totalitarianism. And then there's this deep division in our worldviews with us living in our own echo chambers. So basically what we're seeing also is corporations, mostly again, American corporations that are politically active in myriad of countries across issue areas: tobacco, ultra-processed foods, fossil fuel, plastics, and so on. And of course, they will do so as they have a great stake in upholding a geopolitical system of trade and business that benefits them at all cost, as most of them function in anywhere from 50 to 200 markets. So the interference is global and it's systemic. And these are just some quick examples from across the world, one and specifically of the ultra-processed food industry. In Mexico, Brazil, India, South Africa, the US, of course, we are seeing these entities using trade associations, business groups to really propel lobbying, influence, weaken, and block laws like front of package labeling laws, or laws that actually prevent children and youth from accessing these products more easily around their schools, and so on and so forth. In the US itself, corporate accountability has done some exposure work on how front groups like the International Life Sciences Institute have had deep ties with members of important public committees like the Dietary Guidelines Advisory Committee that helped develop the cornerstone nutrition policy guidance for the country in the form of dietary guidelines for Americans. So why these type of corporate activities must be framed as a liability? And in this, how the lens of corporate political activity can serve as an important one. Because such interference actually takes many names, right? This is corporate capture, conflict of interest, influence, and so on. It is critical to curtail this interference in its entire life cycle and typology. And Nichelle and Alan did a great job in giving real-world examples from the tobacco industry on how these different forms are emerging across different levels of governance. So if we want to move from assessing these type of interference to real accountability, then using this inclusive framework of corporate political activity can serve us well, as it can, again, address the entire life cycle of interference. And I will not go too much in detail because we already heard in great depth specific examples of this, but electioneering, lobbying, influencing science, actually having direct relationship with researchers and academic institutions, and then co-opting charity for further health washing, and also using multilateral systems where what should be a democratic multilateral decision-making processes are increasingly co-opted by multi-stakeholder type arrangements. And this is why we need to frame this type of industry interference as actual liability for corporations. When industries release tons of pollutants in the water or air or soil, is liability the same must apply when they penetrate and pollute our political and democratic spaces and processes to aggressively protect their profits, undermining public and environmental health. And now even business institutions, investors, and the public are recognizing that poor and weak governance practices, especially related to corporate political activities and lack of transparency around them, do manifest into unexpected financial, legal, reputational risk, also affecting long-term value of companies' brands, products, and even market shares. So further moving toward real accountability, any accountability that solution that we may tackle or explore must have a comprehensive strategy. And I think this came across in Alan's presentation as well. It needs to address all levels of industry influence. So cannot be a whack-a-mole type of scenario where we repair this gap of, say, having conflict of interest disclosure, and then another revolving door gap remains wide open. It needs to advance industry liability. The changes must be locked in through legal jurisprudence. It needs to empower people to access justice and reparation for harms experienced by them due to corporate interference. And tobacco, it again goes across the field. It needs to be long-term, sustainable, and it must strengthen democracy. Because otherwise, any strategy we introduce will only be vulnerable to captured government. And again, this is sort of the way corporate accountability likes to think about it. It's cyclical. It begins with monitoring. Monitoring is the lowest hanging fruit, where we monitor conflict, Then comes measurement, where public scrutiny can actually make us understand how the conflict and interference is resulting in impact. And then sort of managing mechanisms. So how, once the conflicts are found, then what? And then the most essential last two steps of future mitigation, and doing that by mastering, policy protection measures, by creating legal frameworks, including firewalls, transparency requirements, funding disclosure, revolving door protocol, liability rules, and so on and so forth. And we have champions emerging in our own sort of governance systems, multilateral systems like these UNSRs on right to food, right to health, who are promoting this across the board. And there are two good examples for this that we have had some role to play: accountability framework for UN climate talks and accountability framework for food systems governance. Both of these do address in the holistic way how accountability can be advanced across different levers, different dimensions of corporate interference. Of course, in this case, it's fossil fuels. Here, it's agrochemical, ultra-processed food, and so on, industry actors. And then I would move on to quickly some of the model examples. We already mentioned from Nichelle, Article 5.3 of the Framework Convention on Tobacco Control. This is a gold standard. This is really a strong guidance that outlines how the parties to the FCTC must act to protect tobacco control policies from commercial and other vested interests of the industry in accordance with their national laws. And we are actually trying to institutionalize this across the board in the climate and the food spaces as well. Then is the maximizing transparency decision. This is another crucial step forward. So the Conference of the Parties to the FCTC a few years ago decided to require parties, when designating representatives to the sessions of the COP, to declare that they have observed Article 5.3 and have been mindful of the guidelines, not to nominate delegates from the tobacco industry. So our team can speak more on that, but we have seen real impact of this, especially from Latin America region, on how these disclosures are pushing for better sort of accountability standards. Then there are a couple of other examples from the UN spaces. Especially, this is important to note because as the United States is retracting from its international commitments to the WHO, to the UN Climate Treaty, and so on, also often does not take inspiration from other nation states for its own governance. These are some great examples out there that we could be deliberating right here in the US. The FENSA, which is the framework of engagement with non-state actors, adopted to guide the WHO's engagement with NGOs, private sector, philanthropic foundations, academic institutions, while laying provisions that can protect the WHO's work from potential risks of such engagement. It's certainly not perfect in any way, but it's certainly a great point to begin exploring this kind of a framework approach. And then also the financial rules and regulations that have some very specific fiscal guidance on preventing conflict and industry interference from WHO's mandate. This is a real good news for us. We have been involved in this effort, but the UNFCCC, which is the UN Framework Convention on Climate Change, after more than 3 decades of organizing by activists, a coalition which is big polluters, kick big polluters out, have been able to secure this first step of having the participants of the UNFCCC actually disclose their affiliations. And this year, in fact, there was a next step made in this effort where, in addition to all participants continuing to publicly disclose their affiliations, they are now required or expected to publicly disclose who is directly funding their participation at the UNFCCC, and publicly confirm in writing that their individual objectives are in full alignment with the UNFCCC, Paris Agreement, and Kyoto Protocol. And most importantly, this information will be publicized for all to see. So public, again, transparency, accountability, and liability sort of go hand in hand. And last but not the least, there are some countries that are actually moving ahead on some of the strong policy measures to prevent industry conflict, from tobacco to ultra-processed food to agrochemical. Countries like Brazil, Colombia, Mexico, amongst many others, have strong codes of conducts and policies on conflict of interest for government officials. For example, in Brazil, the agenda of senior government officials, such as that of the president of the republic and ministers, are publicly disclosed. Brazil and Chile both have had websites dedicated to government transparency. And while in Mexico, India, South Africa, and even here in the US, we have laws that allow citizens to ask for more information on activities of public authorities through Freedom of Information Acts. And in the EU, for example, nearly 7 member states have national legislation that stipulate that former members of parliament must refrain from taking up employment or engaging in a paid relationship with private sector for a certain period after the end of their public mandate. And certainly many of these need further strengthening and implementation, but they do offer strong precedents. So just to conclude, ultimately, we need to see industry interference as a dysfunctional and unjust architecture of power, where power has been sort of transitioned and then hoarded in the hands of a very few elite corporations and their executives instead of being shared among workers, consumers, communities, and people who make corporations and governments even possible, and to whom they must remain accountable. Thank you so much. And I also would like to just thank my colleagues from Corporate Accountability, Daniel Dorado and Jaime Arcila, who co-lead our tobacco campaign and are present in the audience, for inviting me to share a lot of their work here. And thank you, Lauren. Back to you.
Thank you, Ashka. And you mentioned Daniel Dorado, so we'll invite him to also join the panel for the Q&A section. So we will invite Daniel Dorado, who's a lawyer and directs the tobacco program at the Corporate Accountability. He will be joining the panel. If you have any questions, feel free to send them to us via the Q&A session. I received some and I received some others through direct messages. The first question I'm going to start with is actually around the media covering from the U.S. Tobacco Industry Interference Index, and at least I've seen a few from the United States that came up, and what was interesting is they made it sound a little bit like as if tobacco industry lobbying was a bit of a partisan issue, but it seems like from the data that you have that tobacco industry does not discriminate across parties. It will lobby anyone and anyone who has power. Can you expand on that maybe a little bit, Nichelle?
Yeah, absolutely. This report basically shows that this is not a partisan issue. Protecting public health from corporate influence shouldn't be, it is nonpartisan. The tobacco industry, we've shown examples that have bridged both administrations. So we can't just pinpoint one administration that has done worse than the other, because the US score has been just as bad under several administrations since we started reporting on tobacco industry interference in the US. And I think, any transparency and accountability that we can bring to the government would help to benefit everyone, not just one political party over another. So that's what I would say there, but I'm sure others will have more to add.
Alan, did you want to add to that? Or Daniel?
Yeah, no, maybe just briefly to say, it's obviously different political context, but in the UK it's similar in terms of the examples I gave, where we're seeing political party events being sponsored by the industry kind of across the board. I do think there's maybe perhaps more nuance in terms of some governments perhaps appear to have in the past had better relationships with the industry, but again, to the wider point, the industry is trying to influence government regardless of who that government is, and so that is really the key issue.
You're muted.
Thank you, Alan. And my next question is for you, actually. You mentioned some of the various ways within the UK the industry had influence, and you mentioned one that really surprised me, and it was the UK in the context of the Comprehensive and Progressive Agreement for Trans-Pacific Partnership. So that's a trade agreement that the UK has ratified and engaged with a number of Pacific countries. And I understood that this trade agreement had a tobacco carve-out to not facilitate and to not allow the use of the tobacco industry to then use bilateral trade agreements to challenge other countries that implement tobacco control policies. So I was really surprised by what you had, where some tobacco products had zero taxes on import. Can you expand on that for a second? Because that's actually a pretty big thing.
Yep. So, I mean, maybe I'll just speak in terms of for this addition of the index, part of that, the process for answering the question in terms of preferential benefit for the industry was to explore kind of the official kind of government data available. And literally in the UK context, they identify the different levels of tobacco imports for different types of tobacco products in the different countries relevant. And then we have explanations as to why those are priced as they are. And so what I had done was I identified from that data publicly available online that actually indeed there are these measures in there which seem to enable products to be sold with zero duty, and that was kind of one example I gave, but I think there are other kind of instances as well from that data, and yeah, I mean, but perhaps we could pick up separately in terms of if that's potential breaches in terms of your understanding of how that legislation could be used. It's entirely possible there is something happening there.
It also totally goes against the protecting the health of UK citizens and protects tobacco industries in other countries, which I
Exactly.
found unusual. My next question is then for Ashka and Danielle, actually, and it ties to two questions. So one, Ashka, you brought up the various industries that are that are engaged in corporate influence over policy. You give various examples over fossil fuel, processed food industries. And so, as you mentioned, we're very fortunate in our field in tobacco control to have Article 5.3 integrated, something we have been engaged in the plastic treaty negotiations and fossil fuel, plastic industry, and even food industries who oppose any restrictions on packaging of plastic packaging. So we've seen a lot of corporate capture. So the question for you, Ashka, is, and as you mentioned, we're so fortunate because we have a kind of a gold standard on one side on FC on 5.3, but inadequately implemented maybe or inadequately. So what can we do to maybe it seems like outside of health ministries, there seems to be very little awareness of 5.3 or the importance to address corporate conflict of interest in this context. So any lessons from other fields, things we could do better to educate other ministries about the existence of 5.3 and as a best practice tool to protect against corporate malpractice, so to speak, and malfeasance.
Thank you, Lauren. This is what we do. This is why we work very closely with all our teams that work on different issue areas, with challenging different industries and exposing their tactics. And Article 5.3, oftentimes I don't even kind of position it as a tobacco success. I think it's a success of civil society, social movements, and people to fight a very egregious industry. And so one of the ways I think we could, and you're right, in a way that ultra-processed food and fossil fuel industries, it's difficult to push for these kind of very strong gold standard policies, also because a lot of clinical researchers who look at ultra-processed foods keep saying that they're challenged by the industry because there's where is that smoking gun for ultra-processed foods the way there is nicotine for tobacco? And so not only that Article 5.3 is urgent, in fact, right now, a lot of ultra-processed food industries are trying to position their products as essential services. We saw that in the COVID-19 pandemic. I think it will be a hard sell for tobacco companies to, I mean, I'm sure they have tried that in the past, but position cigarettes or tobacco products as essential services. So I think we just have to have much more intersectional and a collaborative work environment where we are not just looking at tobacco industry in isolation. Tobacco industry learned its lessons from sugar industry. I just read a paper on this from the 18th century, 17th century things that, times in which sugar industry was using these tactics. So, and then it's ultra-processed plastics. We all are also organizing in the pandemic treaty space. So pharmaceutical companies are also now kind of sharpening their political claws, So I think there has to be intersectional work. And in this, corporate accountability has written, and we kind of show up in very different spaces to push for Article 5.3 type policies, where we have delegates or representatives from different units of governments, not just tobacco control addiction, but like agriculture and sort of clean air and clean water folks. So I think we'll just have to break down silos is what I would say in conclusion.
I'm conscious of time, so last question is for you, Danielle. There's a number of topics on the agenda of this upcoming Conference of the Parties of the FCTC, the negotiating the next round of negotiations for the tobacco treaty, for those of you who are not so familiar with it. And there's a few topics that are particularly, the tobacco industry is always interfering in that process, but there's a few topics that are particularly, I guess, dangerous for the tobacco industry. The concept of forward-looking measures that go beyond the ones that are in the treaty, so going as far as phasing out or banning tobacco products or the banning of cigarette filters. And then there's the proposal from Ecuador on transparencies within the treaty process. How is the industry already acting and reacting? What should we do as we prepare for the treaty negotiations?
Thanks, Laurent, and thanks everyone for having me here. I feel like a spoiler, but I will do my best to jump with an answer. Indeed, as Ashka and the rest of the panelists have already shared, the upcoming tobacco treaty meetings in November in Geneva are an every 2-year discussions for those governments that are part of this international treaty. The last one took part in 2024 due to a postponement, but the upcoming one, as you mentioned, have critical topics that cause I could say that cause a lot of noise and alarm to the industry, because they land to the point that Ashka was pointed out, to hold them accountable for all of the damages that they are causing there. So there are topics regarding liability, Article 19, on environmental issues, that is Article 18. You already point out the efforts that countries are trying to lead to protect their delegations from tobacco industry interference. The Conference of the Party has adopted the language of maximizing transparency in order to protect that all of the delegates that are going to be there are create a firewall against any attempt of the industry to make part, because I wanted to be very clear. This international treaty was visionary in terms of all of the harm that could cause, that those ones who not need to be seated on the table could be excluded. So probably my closing remarks here will be, the industry is pushing very hard to be there. There is a need, and to connect the dots with what we are here today, this revolving door mechanism that in the United States is quite present, of representatives from the industry, and it operates in every part of the world, going to governmental agencies and vice versa. It is something that this international treaty has been trying to address. So the efforts on maximizing transparency is just a reminder of all of what could cause that an industry that profits from debt could be seated there in the negotiations. Ashka already pointed out the points on the other international treaties. And the Article 5.3 should continue being the blueprint to protect the evolution of this treaty, and crossing fingers it could mimic with its own particularities. Ashka has a lovely word that I try to bring in the spaces, that is cross-pollination. I feel that the Article 5.3 should cross-pollinate the other international spaces and the public health policies agenda. Thank you, Laurent.
Thank you, Danielle. I know we are conscious of time, and we're running to the end of the session. I understand that, so on the 11th there will be the launch of the Global Tobacco Industry Index. If there's some of you who are represented from the media, there will be a press brief and information. So you can, if you want information about this, it's press@exposedtobacco.org. I repeat, it's press@exposedtobacco.org, and I think Megan can put it on the chat for everyone. We also have a town hall on December 2nd. And again, we encourage everyone to join the Tobacco Endgame Policy and Advocacy Training course. Again, I want to also take this opportunity to thank everyone who joined us today, as well as all of the panelists for those excellent presentations. Sorry we didn't get to all of the questions. I got a few offline and a few that came through text and so on and so forth. So, and try to, if things have been addressed already through the presentations, then we often try to go through some other questions. But thank you everyone for joining us today, and looking forward to